I'm the Business Development Head for Cleveland Clinic in India, also Founder Director of IMAS Healthcare, which offers teleconsultations in collaboration with the clinic by Cleveland Clinic. Today, I'm honored to sit with esteemed guests from Cleveland Clinic as well as Meghe group of hospitals. With no further ado, I'd like to quickly introduce Dr. Akil Bindra from Cleveland Clinic. Dr. Akil Bindra is a very renowned pulmonologist from Cleveland, Ohio. And I also have Dr. Marar and Dr. Sandeep Shrivastava. First of all, kudos to you and congratulations for the commitment to establish such a high-tech telemedicine center right in the heart of Nagpur. And so Dr. Marar, what's your vision for this telemedicine center? And how do you see this center serve the community of Nagpur and beyond?
Basically, we have seen there are many citizens, especially Central Indians, who mostly in cases of, like you can say, some degenerative disorders, terminally ill patients, they are very keen to have in second opinion of in very senior specialists. This query question comes to almost all clinicians who are treating people here in Central, sir, और किसी से पूछ सकते हैं क्या? And some of them may have relatives in US, some may have relatives abroad, but not all of them have the privilege of either reaching out to especially one of the best centers like Cleveland to get a consultation and get a second opinion and ratify the treatment or also modify the treatment which has been provided by the clinician. So this privilege, usually Dattaji Meghe, he was instrumental in ensuring that many people, they could go to abroad for further consultation, but needy Central Indians, they did not have that privilege. That's why this tie-up through IMAS was undertaken through the efforts taken by Dr. Sandeep Shrivastava here, our Director Global, and this venture has been realized. This telemedicine center should be a boon for those people who do not get an opportunity to reach out to centers like Cleveland to get the best of the opinion, best of the advanced modalities available. But sitting here in Nagpur through the telemedicine center, available and installed and commissioned in Shalnita Meghe Hospital and Research Center, they can have that privilege and opinion. Its beautiful system and SOP has been established wherein all the paper formats, all the documentation, including it's not required that the clinician should be from our group. These clinicians can be any private practitioners who are practicing in Central India. They can bring their own patients, they can pass on those documents, and once after the screening, the IMS decides and concurs which consultant will be provided and made available for those, and subsequently a 45-minute consultation is being provided. That is more than enough for the clinicians sitting there in our center, in telemedicine center, face-to-face with the clinician from Cleveland, and also clarifying all the queries along with the relatives they can sit across. And I think this is a boon for the Central Indians. Thank you.
I wanted to say thank you so much for considering Cleveland Clinic. I know you have an option to work with so many large medical centers out there, and we really hope to fulfill the commitment of patients first to this collaboration relationship. And of course, my next question is for Dr. Sandeep. And Dr. Sandeep, our journey has started 2 years ago, where I visited your campus, you visited our campuses, and it took a lot of site visits, assessments, and thank you for putting through that rigor of our assessment process before we actually signed the relationship early this year. So I'm thankful first for your patience through the process to get this engagement going. And what is your vision? Because you truly are so passionate about bringing this world-class care to the community, and you really had that vision 2 years ago. If you can share your vision, that will be very helpful.
Deepika, I am so much thankful to the Cleveland Clinic, you and Akil Bindra sir for being with us today also and yesterday also when it started. The whole thing was like when we were given chargeship by the Chancellor Sir, Shri Dattaji Meghe and his son Sagarji Meghe to look globally. So that gave us a task that let us build the things where some international footprints comes into the institution. Now, as you rightly said, there's a lot of competition in that area also. So we went to Mayo Clinic, we went to John Hopkins, we went to Weill Cornell, and of course we went to Cleveland Clinic as well. I think so, dilemma for us was to choose. We never wanted the things to go in conflict with each other. So there was a dilemma with us what to choose from which institution. And the best came from Cleveland Clinic. The entire Cleveland Clinic is virtually in our campus now. So that was the, I think so.
It's so powerful just to hear.
Yes.
I hope it excites the community.
Definitely. I mean, there's no way you can bring an entire hospital into this. And with our experience, what we have undergone during COVID times, we know how powerful the e-learning, e-health systems are. So the virtual presence of the entire Cleveland Clinic into our campus is huge. And that is what we are looking forward to, that the whole, not only the population of Nagpur, which is definitely a big metro coming up, but then also a very rural-based population like Wardha gets advantage of it. So it's like both. We are working towards equity and equality of the healthcare through your presence in the campus. So I should be, I'm really excited. Now it's like, it has, I agree with you, it had been a rigor process. We had sent a 400 pages sort of an audit to you to get approval from your boards and everybody. And it took some time. Yes. We visited your campuses. And we were so happy that today the things are getting shaped up and dreams are getting realized. So thank you so much.
Thank you so much for sharing that experience. Now I'd like to ask Dr. Bindra what he feels as a value add from a Cleveland Clinic standpoint through the relationship that we have, this telemedicine center in collaboration with the Clinic by Cleveland Clinic. Where do you see Cleveland Clinic adding value to not just citizens and community of Nagpur, but beyond?
Yeah, thank you for asking. You know, one of the main mottos at Cleveland Clinic is patients first, and really the medical community in Cleveland is truly dedicated to that. I see the telemedicine program being yet another avenue that our doctors can go and evaluate patients and really feel that they're seeing a different set of patients that will give them a completely different set of gratification than what we do on a day-to-day basis. I see the program really expanding by leaps and bounds. I see a number of physicians from multiple different specialties being more than willing to give their time and expertise to support the doctors that are already here and really kind of work collaboratively. I think that's the key word, that to deliver the world-class care to the patients of Nagpur and the surrounding areas. And really that's sky's the limit from the way I look at it.
Thank you for sharing that, Dr. Bindra. Any challenges that you see in the process, or in the acceptance of second opinions in general? It takes some time for physicians to go through the process and accept, just like any other system. So do you have any tips or advice for physicians, particularly to embrace second opinions, not just with Cleveland Clinic, but in general?
Yeah. So I'd be naive if I didn't think that there was going to be some challenges. There always is. Some of them are blind. We don't see them until you encounter them, and then we navigate them accordingly. Some of them are just simple logistics. You're just talking about like a 9.5-hour time difference. When are we going to do it? Is it going to be, is a patient going to show up at 7 a.m.? That seems unrealistic. They're so difficult to even get that kind of access. So I think the time difference is one of the main ones, but that's not insurmountable. It's just going to take a little bit of creativity to kind of work through some of those logistics. But I think if we go through it the proper way, and we will get buy-in from the team, as long as we give the team in Cleveland the flexibility that they want. And we'll have to work to do that. To me, that's the most obvious logistical problem. But I'm sure there'll be others, but as long as we're all working together, we'll be able to overcome all of that.
Great. Yeah, most of our consultations are organized somewhere in the evening, which is, first hour for Cleveland doctors. But yeah, I think, like you said, we do have a robust process in place to handle some of the logistical challenges.
I would like to ask one question to you, sir. Visited Wardha campus and today Nagpur campus also. So what do you feel? What is your perception about the patients screened and also the facilities made available?
Yeah. Thanks for asking, because I've, in private conversations, I think I've shared some of those thoughts. But the facilities are really beyond astounding. And when I think of the fact that even in Wardha, like everything started roughly 30 years ago, and to what it is now, and now Nagpur, having just come on board about 5 years ago, already having a graduating class, and really starting from scratch essentially and building again is really breathtaking. And you know, when I think about what has been done in that time period, it really gives me confidence that some of the things that we're talking about with like telemedicine and such, that's, you know, that's nothing to get that off the ground compared to what has already been done. One of the examples that you know, Dr. Grandhi has been sharing with me over the last week or so is just how out of the gate the vision was to have, from Dattaji, was to have cardiac surgery being done there. And, you know, quite honestly, 30 years ago, I could see how that could be laughable, and that's being done and so much more, transplants and such. So really, it's been inspiring.
Thank you, sir. Thank you.
Any closing remarks from the Meghe group regarding the telemedicine center, or that'll be helpful?
I can only add that I do hope that needy Central Indians utilize this opportunity and facility. This is a platform which has been provided by Meghe Group of Hospital just to link the needy patients and the clinicians of Central India to Cleveland Clinic, and this can only be optimally utilized if people take the benefit and ensure that this facility continues in the larger interest of the patients. The clinician should not feel like have any kind of insecurities, because they are getting the best of the second opinion from the Cleveland Clinic, and also this helps also to ratify their treatment protocol which they must have been undertaking for their patients. Thank you.
Like the same way I was saying that second opinions are not a very common in the consultations as far as patients are concerned. So there has to be a shift in the mindsets as well, and we need to educate them what is second opinions, what is meant for, and how it is going to be beneficial. I think so the onus lies on us as a hospital, Meghe Group of Hospitals, to convince the people that second opinions are very valuable opinions, and also that they are very precious because they are coming from, right from, I should say, horse mouth, the Cleveland Clinic.
Go ahead.
And kind of one last comment about second opinions is that we do this internally all the time. We're bouncing cases off of each other within the Cleveland Clinic. So the second opinion culture is ingrained there, and we work collaboratively with our physicians, meaning that under no circumstance is there ever going to be a situation where somebody is somehow saying that the care being given was somehow off base or anything of the sort. It's a very collaborative thing to kind of get the patient the care that they want as a team, not as one person taking over. So I would consider that as you look for you know, opportunities to kind of utilize the services that are, you know, that are there.
Thank you. So I think all in all, second opinions are inevitable. Patients want it. They need it. We are living in an information era where we have a lot of patients Googling, asking for information. They're more confused, and with the greater amount of innovation in medicine today, there are more than one way of treating conditions. And this is where some of the confusion, the questions arise. And so I think just in my perspective, it's inevitable, and we'll have to embrace those. Thank you. Thank you so much for your time today.